All right, you likely have done this before, felt sick, and then looked up your symptoms online.
Guilty, but doctors and tech experts both say tools like AI is contributing to medical misinformation. Rena Sargentopoulos from our sister station in Minneapolis explains.
Here are 3 easy ways to improve your health.
You will not catch me with a name brand of pharmaceutical.
Your feet can tell you a lot about your internal health.
There is so much information out there on any topic you choose, and unfortunately,
I saw on TikTok that if you juice a potato and drink the juice, it kills the strep like right away.
not all of it is accurate.
The algorithm knows what you want to hear, and it will repeat it again and again and again in different forms. And so these sound bites, these repetitions become truth. And it is much harder to debunk this perceived truth than it was ever before.
Dr. Natalia Dorf-Bitterman with Health Partners says medical or health misinformation has amplified over the last several years, and it's impacting the doctor-patient relationship.
It is impacting the way that we trust each other, the way that we engage with each other, and certainly it can impact the health outcomes of our patients.
Dr. Dorf-Bitterman says it's causing people to delay or avoid care or to use dangerous non-scientific treatments or advice. And her points are not anecdotal. More than 60% of doctors, according to the nonprofit The Physicians Foundation, say they have seen misinformation and disinformation influence their patients.
20 things you're not going to hear from your doctor that, in my opinion, make a massive difference.
Perhaps in part because MIT researchers found that health misinformation spreads 6 times faster than the truth and is 70% more likely to be shared than accurate information. So, how do you spot misinformation, especially when some people claim to be doctors or experts? Check their credentials. Stay clear of influencers or others who are using fear or confusion to engage with your emotions. And most importantly, if they're trying to sell you a product or a service, pass. Now that can be particularly hard to tell with AI-generated deepfake doctors, something the American Medical Association has declared a public health crisis. That said, AI does have some benefits too.
When used with good sources of information, it can be extremely helpful. When used with sources of information that are broad, it can be really harmful.
Telling AI to use only peer-reviewed, scientifically proven sources is a good place to start. Then use it to come up with informed questions for your practitioner. But it doesn't know you or your medical history, so it can't serve as a replacement.